Okay, Congresswoman Sewell, I think we'll get started this morning.
Sounds great.
I want to welcome you, Congresswoman Sewell, to this call this morning. I know how busy you are right now, and it means so much to the Montgomery Chamber and our membership that you're taking time to be with us this morning. So good to see you, and I hope all is well with you and your family and your staff.
It is. Thanks so much, Anna, for the opportunity to be able to communicate with you and the Montgomery Chamber, all that you all are doing to try to help our constituents and your customer base and the folks that we all represent to stay healthy and safe during this pandemic. So thank you for the invitation.
Well, absolutely. And I just want to say to our membership and partners on the call, you, Congresswoman Sewell, and your staff are always so responsive, good to work with here in the district, particularly supportive of our community. Maxwell Gunner, always with the F-35 initiative, your role there was just tremendous. We're so excited in the midst of the pandemic. We have good economic opportunities ahead of us and brighter days ahead. So and you've been a big part of that, and we want to thank you for that. I think today how this format will work is we will let Congresswoman Sewell have the floor to hold a bit of a briefing with us and give us some insight on what's happening now in Congress, particularly as it relates to the pandemic, much of the small business relief packages, things that may be in the pipeline coming up, Congresswoman Sewell, but also the health and safety issue of the citizens in your district. I know testing is an issue. There are concerns. We're so excited to be seeing our economy starting to come back, our state and our community starting to open up safely. I know you and your staff have done a lot of work on that and have been in the district meeting with communities on that. So anxious to hear from you, and we'll let you have the floor.
Well, thanks again, Anna. I really want to thank the Montgomery Chamber of Commerce, and I especially want to give a shout out to Sharon Rose. She was a member of the Alabama 7th Congressional District COVID-19 Advisory Group. As many of you know, Governor Ivey asked members of Congress from our delegation of 7 to put together advisory group and give her advice and recommendations on how best to reopen Alabama, given the fact that we all have very different districts to be able to put that together. And so I was just thrilled that Sharon Rose represented the Montgomery Chamber and was a part of the stakeholder group, and want to thank her for her continued support and her great efforts with us on that effort. So I think that that's probably top of mind, but I wanted to share with you what I do on a daily basis. I tend to get up in the morning with my cup of joe, and then I go and check the Alabama Department of Public Health's website to see what changes have been made. And as of this morning, we have 6,779 confirmed cases of COVID-19 in Alabama. That's a total increase of 240 over yesterday's report. The state has tested 76,584 Alabamians. And then my staff gives me a breakdown of how it affects our district in particular. I think many of you know that our district with 14 counties, the urban areas being the city of Montgomery, Jefferson County, which is a hotbed, as well as we share Montgomery County with Martha Roby and with Mike Rogers. And we also have Tuscaloosa, which we share with Adderholt. And then we have the 9 counties of the Black Belt, central of which is my home county of Dallas County in the city of Selma. When we look at the statistics, I'm often reminded that they're not just numbers, that they are our neighbors, that there are church members, that there are our family members, and that these statistics are really the guiding light on how our North Star, on how we should approach the problem of the COVID-19, which I think all of us know is a public health crisis, but has also led to an economic crisis. I understand that you've already had Senator Jones on recently. And so I think that for me, where I will start is sort of where we are. Yesterday, the governor rolled out her phased-in approach for reopening Alabama's economy. I'm very proud of the fact that we were able to put out our report, all 55 pages of it, last Wednesday. And our report was, I thought, pretty thoughtful in the sense that we had, as a part of our stakeholder group, 50 plus individuals, including, Alabama's 7th Congressional District is home to Birmingham, which is home to UAB. And we had Will Fernanny as a part of our stakeholder group, who runs UAB Hospital. We had the Dean of UAB's Public Health Department, Paul Irwin. And we also had the Jefferson County Public Health Officer, Mark Wilson, as a part of our stakeholder group. And ultimately, I think all of us want Alabama's economy to be opened up, but we want to do so safely, we want to do so strategically, and we want to do so responsibly, was sort of our mantra in our report. And I was pleased to see that Governor Ivey had an approach that was a phased-in approach. That's what our report suggested, that she was guided by the science and by the data and not by a particular date, that she had as a part of her advisory group, Dr. Selwyn Vickers, as well as Dr. Nancy Johns, and of course, Dr. Scott Harris. And so I was pleased to see that she took a measured, phased-in approach with consideration of the various needs, and that businesses, trying to make sure that businesses who can resume operations under social distancing, providing those guidelines was critically important. So I think all in all, I thought that the governor's approach was a measured one, phasing in. I thought also that I was happy to hear Dr. Harris talk about vulnerable communities and making sure that we're taking into account the statistics that show African-American community in the state of Alabama only make up 26% of the population, but sadly make up 40% of the cases and about 50% of the deaths to COVID-19. We have to keep our eye on that. I know that I will, as the member of Congress that represents a majority-minority district. I think that that's critically important. The governor's guidelines don't prohibit people from leaving home, but I think it's important upon all of us that we continue to try to prevent the spread of this virus. So my recommendation still stands in line with Governor Ivey's, that we do all that we can to promote physical distancing, and that we also mandate, or not mandate, but we also use best practices when it comes to facial coverings. I encourage all Alabamians to heed that recommendation of the healthcare professionals and to cover our nose and mouth with face masks as much as we possibly can. I will, Anna, go into our report more in detail if you'd like me to, but I thought what I'd hit on is sort of the highlights. We issued a report. Our report findings were about safety measures that one can employ, as well as making sure that we're opening up Alabama's economy, and we do so in a safe and a socially responsible way. Definitely looking at the lack of testing in the Black Belt, which is a source of consternation for me daily. When we look at the reports from the Alabama Department of Health, I get my report every day from my team broken down by counties. And we look at, for example, Greene County. Greene County has had total number of tested 138 people, 47 of whom tested positive. That's a 34% confirmation rate. We've also had 1 death in Greene County. And so those kinds of stats really do concern me. And I think it concern all of us. We have to do our part in rolling out testing sites. I was honored to work with Joe Bonner and the governor's office in trying to get Walmart to not only offer free testing in Montgomery and in Birmingham, but also they're rolling out a mobile unit this week in Selma, Thomasville, and Demopolis, offering testing with Quest Diagnostic. It's a partnership that Walmart has with Quest Diagnostic, and was very grateful that we're getting additional testing sites in Selma, Thomasville, and Demopolis. We'll continue to work with the governor's office and work with private industry to try to shore up the number of tests. Nothing is a substitute, however, for us getting it right on a state level. And so working with Scott Harris in helping to shore up Alabama's public health department's lab as well as their mobile units is something that we're constantly working on as well. So testing is clearly still a very big concern. As many of you know, Congress has passed 3 pieces of legislation. I'm sure that you're all well aware of that. The most recent piece of legislation, I went back to Washington, D.C. last week, and Congress passed a supplemental package. I guess that's 3.5, CARES 3.5 is what they're calling it. But that offered an additional funding for small businesses. $310 billion was added to the Paycheck Protection Program. Another $50 billion was added to EIDL, the economic injury disaster loans that are administered by SBA. Another $75 billion was added to hospitals and to healthcare providers to fight on the front lines this COVID-19. And an additional $25 billion went specifically to testing. And so I was happy to put on my mask and all of my protective gear and to get on the plane and go to Washington, D.C. To both debate about that package. For me, I got lots and lots of calls from my constituents that the PPP program, the first tranche, that was $250 billion, that so many of them had a hard time going on to the portal to getting lenders to answer their. I think that for me, I wanted to make sure that any supplemental package fenced in some money so that we could make sure that it goes to Main Street, not just to the big companies. I think all of us know that the PPP program has not been without its own controversy. We saw reports that Ruth Chris got, the steakhouse got $20 million, that Portbelly, another national chain, got $10 million, and that Steak and Shake got $10 million. I understand that they returned their money, but I think all of the members of Congress, and I can only speak for myself, wanted to make sure that truly small local businesses, our mom and pop shops that are on Main Street, Montgomery, and Main Street, Selma, and in the Black Belt, that they had an opportunity to also get these forgivable loans and these grants. The whole idea of the Paycheck Protection Program was to make sure that we are encouraging business owners to maintain their payroll by the federal government making their payroll for them and being able to get those resources. I want to thank Scott Latham and Alabama's Banking Association and Jason Isbell and others who really were instrumental in trying to make sure that when I called that those lenders that are local lenders in Alabama were really trying to help the truly small and local businesses. And that will be just as important now. I'm actually doing a Terri Talk live after this event with several of the CDFIs that are given resources and community bankers that are lenders that are still accepting applications from small business owners through the PPP program to talk about some of the pitfalls, to talk about the checklists, and to try to get the resources in the hands of the folks who need it most, our local business owners and our minority business owners, our barbershops and beauty shops. That's critically important. You know, I think we are currently working on a CARES 2 Act, and what's going to be critically important for me in making my recommendations to the Ways and Means Committee and to Speaker Pelosi and leadership, I want to make sure that we are infusing providing direct support to the most vulnerable. in the case of providing unemployment benefits to those, the federal pandemic compensation, making sure we shore that up, making sure that we also have resources if we need another direct payment stimulus check. As the longer this pandemic goes on, the more direct payments I think that we make to individuals, the better off I think we'll be. I know that Fitzgerald Washington, our Secretary of Department of Labor, is working hard and has gotten out 64% of the claims, $300 million to Alabama for unemployment, but we're watching that. I know that our government portals and technology has not been the best when it comes to rapidly getting these resources out to the most needy in our community. So we have to make sure that we're providing resources to make sure that he can do his job of both rapidly rapidly getting to the unemployment claims that he's getting, but also getting that money out expeditiously to the folks who need it. I think that the coronavirus has really put a spotlight on some of our infrastructure needs. I've been talking a lot since I've gotten into Congress about broadband, and we want to make sure that any Recovery Act does get us better broadband. That's been tested and highlighted by this COVID-19 in a way that I don't think any of us would ever anticipate. Everything from having our school-age children having to do distant learning on the internet to applying for federal assistance, be it SBA loans, PPP, or unemployment on the internet. I truly believe that this country, this great country that we call home, if we can get electricity to every village and every hamlet, we should be able to roll out internet service to every town, every village, every county throughout America. And that should be a priority as we look at recovery efforts for this pandemic. Also getting local government. I know that the state is going to get a lot of resources for local and state stabilization fund to try to make sure that we're meeting the needs of local government. I hear from my mayors and my county commissioners daily about the loss of revenue caused by this pandemic, and what we're doing to try to make sure that we are giving them the resources they need to do their job. That's going to be top of mind for any CARES 2 package as well. And I just think that we have to make sure that this administration is focusing on local and state governments as much as possible. We wanted in this supplemental package that we just passed, not only to do top up small businesses, but also provide resources directly to our state and local governments. The CARES package provided mostly to those governments that have 500,000 or more residents. And in the state of Alabama, that's only the state of Alabama and Jefferson County. So clearly we have to do something to top up our local and state governments when it comes to providing resources for them as well. I know I've talked a lot, Anna, about our report, reopening Alabama's economy. I've talked about the government response in the three pieces of legislation plus the most recent supplemental package. I really wanted to hear from you all about what you're concerned about and try to answer your questions. I just want to close by again saying that it's an honor every day for me to have the opportunity to represent Alabama's 7th Congressional District. It's not only the district I represent, but it's the district I grew up in. I understand all too well the challenges of the Black Belt, having grown up in the Black Belt. But what I know for a fact is what we lack in economic prosperity in the Black Belt and throughout my district, we more than make up for in heart and spirit and fight. And what the people of the 7th Congressional District deserve are better opportunities and more resources. And every day I fight for that. And I want to thank the Montgomery Chamber for your efforts. I think all of us are going a little stir crazy when we think about the stay-at-home order and now the safer at-home order that the governor has instituted. But what we're talking about is saving lives by doing that. And there's nothing more important than maintaining our own personal safety. I think that this whole coronavirus has really made it, has brought to light the need for ourselves, for us to be our own best personal advocates for ourselves, our communities, and our families. I look forward to working with all of you in the days and weeks ahead and months ahead as we continue this new normal. I think that the reality is, until we find a vaccine or therapeutic treatment for coronavirus, the new normal will be trying to make sure that we're doing everything we can to sanitize our workplaces, that we provide personal safety resources for our employees and our customer base. Needs to be very cognizant of having our own facial coverings, and to the extent that we have supply chain issues, which are real, we need to make our own facial coverings. I've been very lucky to have constituents who were very conscientious in providing me as their member of Congress with coverings for my trip to Washington, and being in the White House, being on Capitol Hill, and conducting our daily routine. We just have to be ever cognizant of that. It's for a person who's used to talking and getting readily feedback from our base. This is kind of weird to be talking in a vacuum, but I know it's critically important that we try to address the concerns of the business community and our community at large. It's an honor for me to represent Alabama's 7th District, and Anna, we can open it up for questions. And I want to thank my staff who's on this line as well, who are still essential workers on the front line, providing assistance to my constituents each and every day. We still are getting lots and lots of calls, lots of emails, and we're trying to be as responsive as possible to our constituents in this time of need. But as we practice our social distancing, I think it's critically important that we make sure that people know that we're there to help them and guide them during this crisis. So thanks, Anna, for the opportunity to speak with you and to hear from your folks about what's on their minds.
Thank you so much, Congresswoman Sewell. We do have several questions, so I'll start with one from Robert, who's asking, kind of along the lines of your recent comments about being judicious and cautious as we re-enter open employment and open workplaces. Do you think employers should continue and encourage working from home as much as possible when feasible and productive?
I do. I think that the safer at home order that the governor instituted suggests that our gradual phase in is to open the spigot. Look, I think that all of us want our economy to rebound, and we know that to me, healthy economies require a healthy workforce. And so to the extent that you have a workplace that allows for teleworking, and believe me, I've worked more at home than ever. I mean, there's no separation. So it's like you wake up early in the morning with a cup of joe at 7 a.m. and I don't go off of Zoom calls and other things until 9 o'clock at night. And there is no separation unless we impose it upon ourselves. I try to take my 20-minute walk around my neighborhood every day around 6 o'clock. Sometimes it's 6 o'clock, sometimes it's 7, sometimes it's, getting up early, that extra hour early just to do it. But I think that to the extent that you have a workplace that allows for teleworking, that we should encourage that. I think that those manufacturing facilities, we have to support our workplace by providing as much resources to help our facilities to stay clean, to make sure that our employees that do have to work on assembly lines have the appropriate face mask and gloves. We have to be ever vigilant. And even opening up our retail, I think it was wise. Our report said that if we're going to do that, let's make sure that we're practicing the physical distancing. So having the retail stores only have 50% capacity is just good guidance, along with the CDC and the White House guidance. After all, we are opening up, even though we haven't seen 14 days of continuous decline in cases. I said earlier at the top of this hour, I look every day. I try to only do it twice a day, in the mornings and at night. The Alabama Department of Public Health's dashboard, because we should all be guided by the fact that this is about saving lives. Yes, saving our economy, but saving lives in the process as well. And so to the extent that we can telework, we should do so. I'm thinking about my own staff. We have one person in every office in district that goes in. So we have a shift that we rotate every day, so that at least one person is physically there, but the rest are teleworking and supporting that person who's in the office, in the Selma office, the Montgomery office, the Birmingham office, and our DC office. But we're doing the very best we can with teleworking, and to the extent that you have a job that allows for that, I would definitely encourage that. We have to also remember that we have to, as quickly as we can turn on the spigot, and we're doing so in a gradual way, which I think is right. If those cases and we see spikes in a second wave, we have to go back and restrict. So I think that, you know, it's in all of our best, the best guidance of the CDC guidance, that we all use our best, do our best to encourage folks to stay at home, to use facial coverings when one is in public, and to only go out when we really need to. And I would really encourage us to help our seniors. I have an 80-year-old mom who I want to stay at home. And so she has learned how to use my credit card and go on Amazon and get those resources that she needs. And we want to encourage our postal workers and our frontline essential workers by making sure that we are safeguarding as customers, that we're using our best practices when we go into those supermarkets, when we go into those local retail stores. Let's do so as safely as possible. And while I understand the governor didn't want to make a mandate, I was happy to see the city of Birmingham say that they are mandating facial coverings when one is out in public. I think that we have to do all that we can to slow this curve. This is a serious public health crisis that has caused a very serious economic crisis, and we're only going to get out of this crisis if we work together. And until we have a vaccine and therapeutic treatments, we have to continuously follow the CDC guidelines of social distancing and personal hygiene.
Absolutely, Congresswoman. And along those lines as well, another question on the chat is, as we do return to work, if an employee is being asked to return to work, what happens when an employee is unable or unwilling because of concerns for health reasons? Will they lose their state and federal unemployment benefits?
So in the the second congressional bill that we passed, the Families First Coronavirus Response Act, we in Congress felt very strongly that if we're going to actually flatten the curve, this is about stopping community spread of germs, that we would have to give resources to employers to encourage employees, if they are symptomatic, if they have to be quarantined, to still be able to have a federal mandate of paid leave and paid emergency leave. And so for truly small businesses that's under 100 employees, the federal government has mandated and provided a fully funded mandate. That's rare for the federal government to give a fully funded mandate, to give employers the resources they need to allow those employees that have been symptomatic or that do have COVID-19 or their family members have COVID-19 to be able to allow them to have paid leave while they're quarantined. And so I would encourage employers to follow the federal guidelines when it comes to the paid sick leave and the paid emergency family leave. What the federal government is giving the employer is a tax credit on your payroll to help you be able to continue to pay those employees when they are quarantined.
Great, thank you. And I will add for you on behalf of the Chamber, you'll see some news coming out of Montgomery today. Mayor Stephen Reed has been holding committee meetings related to recovery from the COVID pandemic. One of those committees was an economic impact committee. And so today at 11, we're going to announce a partnership that's standing up a small business hub in Montgomery so that we can have
Very good.
well, we want people to be able to talk to people. You know, as you said, it's so hard to be isolated. And because so many of the governmental systems and all become overloaded with call centers and websites, we want to create a one-stop local network called a hub. And we loved the word hub because it's about helping unite business in a time of need. And so our County Commission Chairman Elton Dean, our Mayor Stephen Reed, our partners here in the community, Alabama State's SBDC, all coming together to form a real help desk. So we want to be a resource for these kinds of questions. And we're so fortunate that your staff in your office, when people connect through the hub, then we can connect with you. So hopefully we'll be able to even have more access for our community to you and the answers that you provide through this new small business hub.
Well, I wanted to encourage you all and thank you, the Montgomery Chamber. I think that all of us understand that the more you know, the better you can do. And I think that speaking as one voice as much as we can, that this is a public health crisis that has led to an economic crisis, that we want to give people as much information and help them access the resources, federal resources, local resources. And to the extent that you guys are putting yourselves out there as a hub, I think that that's awesome. Do know that whatever our staff can do to help you with that, we stand ready and willing to do that. I think it's critically important that we also understand that all of us are fearful. I think none of us, all of us are fearful. I mean, all of us are worried about our own family members, our workers, our fellow employees, our colleagues getting this virus and what that means. And so we all want to just make sure that we are getting the best information out there to assist as many people as possible. And so I want to applaud your efforts along with the city of Montgomery in establishing this hub and trying to get the resources out there to the people who need it. And I think that as long as we understand that what affects one person does affect another person when we talk about community spread. And so we are all in this together, and we're only going to get out of it together, working together. And it's all about sharing best practices. None of us are experts on any one area, but collectively getting the best information we can, guided by our healthcare professionals, we will get through this.
That's well said, exactly right. We appreciate your support so much. A couple more questions, and I know you've got to zoom off to another Zoom, a day full of Zooms, I'm sure, starting, as you said, early in the morning and going till late at night. Lindsay Crosby, here locally with BB&T Bank, is asking a PPP loan question. Do you think that we'll see a third tranche of funding being authorized? Some people are hearing May timeframe. But perhaps addressing the issue you brought up earlier of large publicly traded companies being restricted from having access to those funds?
So the answer is, I would hope so. I think all of us realize that if this is going to be the new normal, that we're in this a lot longer than all of us anticipate till we find a vaccine and the like, that as long as small businesses need help, you're going to see the members of Congress, and I can speak for myself, willing to go back and create more opportunities by providing more funding for the PPP program as well as for the small disaster loan program. I also just want to encourage BBT and other lenders out there, please try to reach deep in our community and help the truly small and local vendors and businesses out there that may not necessarily do business with you on a daily basis. But I think that for me, and so many of the members of the Congressional Black Caucus, we heard just way too many of our constituents, women-owned businesses, small minority-owned business, a problem even before the pandemic. So we want to really to do their very best, not only to service their existing customers, right, but to be willing to provide resources and help and aid minority-owned businesses, women-owned businesses, so that they too can access these programs. Wow. I had hoped that we would have some set-asides for women-owned and minority-owned businesses, and that the White House and the Senate didn't approve that. The House really stressed that. And I think that you're going to see an easier access of folks voting for more funding if, as we see in our oversight capacity, that these resources are getting to the truly local, minority-owned, women-owned, veteran-owned businesses that we also want to assist. So the banks can help us get more resources to lend out by lending to the truly businesses.
Absolutely. It's a partnership, and that's another reason we're very excited about this hub. Our local banks are going to be a big part of this. So we'll be in communication with them and constantly feeding them the feedback we're getting on the ground, grassroots in our community, and particularly, as you say, really being mindful of those small, very vulnerable businesses in our community, small minority and women-owned businesses that really, really, really need the help, and making sure the help goes to where it needs. Congresswoman Sewell, I believe we have kept you about as long as we can keep you this morning. So delighted to have spent this time with you this morning, and grateful for everything you do for us. To see you in Congress representing our district, our people, it's an honor to work with you and your team, and we're grateful for your service. Thank you so much.
Well, I just want to end by saying again to the Montgomery Chamber, thank you. Thank you for being good stewards of our community, in working with local government and working among yourselves to really try to give the very best advice to our leaders. You know, I say a prayer every night for strength, but I also ask for, I pray for resilience. I know that the people that I represent in Alabama, one of the threads that bind us is that we are a strong people of faith. And I know that with our faith, along with public advocacy and with the resources that our business community is willing to help us utilize, that we will get through this crisis. We can only do so working together. I'm reminded of the fact that healthy economies can only remain healthy as long as we have healthy workforce, and that they work side by side. We have to really resist the false narrative that you can't have a good economy and healthy people at the same time. You can. We've done it before. In fact, before this COVID-19, we saw an economic renaissance that benefited so many people, and we will see that again. That the only way that we can get there is if we heed the public health advice, if we practice it ourselves, if we let our employees know that we care first and foremost about their health and their safety, that we show our customers that we care about their health and safety, that we realize that there are vulnerable parts of our community that are more at risk, and that we take into consideration of that as we do our business practices. And so, you know, I think that the resilience of the American people is something that I take as my North Star, and I know that you all do too. And we will get through this, but we'll only get through it if we work hand in glove together. Business leaders, community leaders, our elected officials, and of course our community. We have to speak in one voice that health and safety is first and paramount, and that as we bring our health and safety in line, our economy will join us in line, and people will feel more confident to go into our stores, feel more confident to go into our workplace. And so it is really all about us, each one teach one and each one help one. And so with that, I want to thank the Montgomery Chamber for allowing me to speak with you this hour. And again, thank you for your willingness to work with local government. I think that the hub announcement, I look forward to hearing that and working with you all in trying to make sure that we provide the resources we need to our community to get through this pandemic. Great. Thanks again for everything.
Thank you so much, Congresswoman. You have a great day, and we are grateful for your leadership. Thank you so much.